You paid for Botox. You followed the aftercare instructions. At least you thought you did. And 4, maybe 5 weeks later, it's already gone. The lines are back, the muscles are moving again, and you're wondering, was it a bad batch? A bad injector? Or is your body just immune to it? None of the above. In most cases, there are very specific reasons why Botox wears off faster than it should. And today I'm going to walk you through all 7 of them. If you're a practitioner, this will change how you assess your patients. If you're a patient, this will save you time, money, and frustration. Before we get into the 7 reasons, a quick recap of the mechanism. Because understanding this makes everything else make sense. Botulinum toxin works by blocking the release of acetylcholine at the neuromuscular junction. Acetylcholine is the neurotransmitter that tells your muscle to contract. No acetylcholine signal, no contraction, no wrinkle forming. This effect is temporary. The body naturally regenerates the proteins involved, specifically the snare complex, and over time, nerve sprouting occurs, creating new terminal plates and restoring muscle function. That's completely normal. It's why the effect lasts 4 to 6 months. The problem is when that window gets cut down to 4 to 6 weeks. And that's where these 7 factors come in. This one happens before the needle even touches the skin, and it's more common than people want to admit. Before reconstitution, botulinum toxin must be stored either frozen or refrigerated between 2 degrees Celsius and 8 degrees Celsius, 35 degrees Fahrenheit to 46 degrees Fahrenheit. After dilution with sterile 0.9% saline, the only appropriate diluent, it must be kept refrigerated and used as soon as possible. What compromises the toxin? Shaking the vial aggressively, introducing air into the vial, incorrect saline volume, or letting the reconstituted product sit too long at room temperature. Any of these can degrade the protein structure and reduce potency before a single unit is injected. If you're a patient, this is why it matters where you get treated. If you're a practitioner, your cold chain is part of your result. There's no universal injection map that works for every face. A result depends on evaluating that specific patient's muscular strength, movement pattern, skin thickness, and where the expression lines actually form. Injecting too superficially, too deep, off target, or with an underdose means the toxin simply doesn't reach the right muscle fibers in adequate concentration. The effect either doesn't appear as expected, or it disappears much faster because the blockade was incomplete. The angle, the depth, the dose per point. These are clinical decisions, not templates. That's why individualized assessment is non-negotiable. This is one of the most overlooked factors, and it absolutely needs to be part of every patient consultation. Several medications are documented to reduce the duration or efficacy of botulinum toxin. Aminoglycoside antibiotics, gentamicin, neomycin, streptomycin, amikacin. These work at the neuromuscular junction themselves and can enhance or unpredictably alter the toxin's effect. Corticosteroids and anti-inflammatory drugs can reduce tissue response. Muscle relaxants, already acting on neuromuscular transmission. Calcium channel blockers, nifedipine, verapamil, commonly used for hypertension. These interfere with acetylcholine vesicle release and can shorten duration. Penicillamine, not penicillin, an anti-rheumatic. Documented interaction. Succinylcholine, a neuromuscular blocking agent used in anesthesia. If a patient is on any of these, it should factor into your dosing decisions and their expectations. The toxin needs time to fully bind at the neuromuscular junction. The first 24 to 48 hours are critical, and certain behaviors during this window actively degrade the result. Heat exposure is a major one. Saunas, hot showers, steam rooms, intense sun exposure. Heat increases local circulation and can disperse the toxin away from the target muscle before it's fully bound. Intense exercise is another. Athletes, especially endurance athletes or people doing high-intensity training, consistently report shorter duration. The increased metabolic rate and circulation accelerate toxin clearance. Lying face down, rubbing or massaging the treated area, and putting pressure on the injection sites right after treatment can also cause unwanted diffusion. Patients need clear post-procedure instructions before they leave the room, not a printed sheet they'll read later. Hormonal fluctuations have a real, documented effect on how the body responds to botulinum toxin. Women going through menopause, or who are in postmenopause, often report noticeably shorter duration. Hormonal replacement therapy can also diminish the toxin's action, likely related to estrogen's role in neuromuscular signaling and skin metabolism. Testosterone levels also matter. Abnormally high or low testosterone has been associated in some studies with altered toxin duration. This isn't about the toxin failing, it's about the body's internal environment changing. Understanding this helps set realistic expectations and adjust protocols accordingly. Here's a counterintuitive one. Getting treated again too quickly can actually make the next result last less. The recommended minimum interval between sessions is 3 months. Why? Because the snare complex proteins, which the toxin cleaved, take between 1 and 4 months to regenerate. If you reapply before that process completes, the muscle hasn't fully reset, and the response to the new application is attenuated. On top of that, frequent reapplication below the 3-month window increases the risk of developing antibodies against the toxin, which is a more serious form of resistance and can reduce efficacy long-term. These factors have been identified in multiple studies as associated with shorter duration. They're not absolute contraindications, but they belong in the clinical conversation. Excessive alcohol consumption affects neuromuscular transmission and may accelerate toxin clearance. Low vitamin D levels link to impaired neuromuscular function overall. High anxiety and chronic stress. Elevated cortisol impacts muscular activity and may shorten the relaxation window. Extreme testosterone imbalances, both high and low, appear in studies as variables affecting duration. None of these mean the patient shouldn't be treated, but they're part of a complete picture. And they're why 2 patients with the same dose in the same area can have very different durations. Now that we've covered what shortens results, here's what the evidence supports for extending them. 1. Consistent periodic sessions every 6 months. Cumulative treatments lead to progressive muscle atrophy in the treated area, meaning over time, you may need less product and effects can last longer. 2. Antioxidant support, vitamin C, CoQ10, PQQ. Antioxidants support cellular and mitochondrial health, including at the neuromuscular junction. 3. Phytaceae combined with chelated zinc, starting 5 days before the procedure and continuing for up to 10 days after. This combination has shown promise in supporting longer duration in clinical practice. 4. Daily SPF. UV damage affects the skin's overall integrity and collagen framework, which directly impacts how expression lines form and how visible they remain. 5. Consistent skincare. hydration, and active ingredients that support skin regeneration help maintain the visible result even as muscular function gradually returns. 6. Following post-procedure guidelines correctly, the ones we covered in reason number 4. That window matters more than most people realize. So, to recap, if your Botox is wearing off too fast, the answer is almost never bad product or your body is immune. It's one or more of these 7 factors, some controlled by the practitioner, some by the patient, some by biology. The good news is that most of them are addressable. If you're a practitioner, run through this list as part of your consultation protocol. If you're a patient, bring this to your next appointment. If this video was useful, save it. You'll want to come back to this list and drop a comment below. Which of the 7 surprised you most? If you haven't watched our intro video on botulinum toxin yet, it's linked right here. That's the foundation. This video builds on it. See you in the next one.